Good morning, and thank you all for joining us here today for our summer workshop on Graduate Student Health Insurance Program. We're going to go ahead and jump in with Jen presenting on our health insurance plan. And we also have Carrie Hill from the Student Health Center, who also coordinates international student health insurance. Both will be here for questions that you might have about anything relating to health insurance. So take it away, Jen.
Make sure I unmuted myself. Good morning. It's rainy outside and it's another exciting topic. Monday or Tuesday was accounting with extended tuition benefit, and another topic to help with your sleep deprivation is the health insurance. We're going to cover the Graduate Subsidized Health Insurance Program, or hereinafter referred to as GSHIP. And we're also going to talk about department paid insurance. And then there's the section on international insurance. And we are lucky today to have Carrie Hill with us. And when I get to those international student slides, Carrie, feel free to jump in and add any extra wisdom or processes that I didn't outline on the slide. So with that being said, we're going to start with a glossary of terms. There's some terms that we will throw around when we talk about student insurance. The first one is GSHIP, and that is the Graduate Student Health Insurance Program. The second term that you may have heard is department paid. There are some departments who choose to subsidize or fully cover the insurance premiums for their students who are not eligible for GSHIP. And then some departments may offer dependent coverage also. And then there's what's called voluntary or direct coverage. This relates to United Healthcare. This is a student who's not eligible for GSHIP and does not have department paid options available to them. They can enroll directly with United Healthcare and pay the full premium. The students must enroll during the open enrollment period. They must be enrolled in 3 or more credit hours. And the University of Utah does have a continuation clause. So if a student was covered in a semester, in this example, it's fall, either with GSHIP or department paid, and the student is separated from the university, they may enroll in continuation of coverage with United Healthcare. Students can also enroll directly with EMI, and we have separate rates for those students. Whereas if a student is enrolling voluntarily with United Healthcare, they have the same rates as a department or GSHIP would pay. What is GSHIP? GSHIP is the official, let's go back. We can edit this, right, Matthew? GSHIP is the official insurance program administered by the graduate school, specifically in the Office of Tuition, Fellowships and Benefits, for those students who qualify for subsidized insurance through the tuition benefit program. GSHIP does not cover dependents. However, a department or program may offer dependent coverage through their department paid insurance. Our health insurance carrier is United Healthcare Student Resources. It's the same policy that Student Health has, and it's the same policy offered to all U students, undergrad or graduate. Our vision and dental insurance carrier is EMI, and that's Educators Mutual Insurance. Effective dates for GSHIP. Students are enrolled twice a year. They're enrolled for fall semester, which is 8/16 through 12/31. And they're enrolled in spring summer semester, which is 1/1 through 8/15. Our effective dates are hard and fast, and there is We don't enroll just for spring. We don't enroll students just for summer. We have 2 enrollment periods, and there have been occasions where some departments will verify that a student will be covered the entire year. And because they need to have dependent coverage, we will enroll students on an annual basis in GSHIP, but that is a exception rather than the norm. In department paid insurance, departments have a little more flexibility to add students periodically throughout the semester. They can also determine, because they're paying themselves, if they want fall only, spring only, or summer only coverages, besides these, enrolling students for spring, summer. And we've also had instances where this student was enrolled, and because of they've hit 26 and they've aged off their parents' insurance, we've had instances where departments have been able to enroll students mid-month. There's a special form that we have that needs to be completed and sent in with the enrollment information, but that type of life event is covered. To be eligible for GSHIP, you need to be on a payroll type assistantship. So they need to be either research assistants, teaching assistants, the new graduate assistant research focused, and the new graduate assistant teaching focused job codes. They also must be 100% tuition benefit eligible. So if you have a student who is a TA but is only receiving a 50% tuition benefit, they will not be eligible for GSHIP. You can choose to pay for that student's insurance through your department, but they will not be eligible for GSHIP. Not eligible are those students not 100% eligible, but most importantly, graduate fellows. Graduate fellows are not funded through payroll, so we do not have a mechanism in place to collect the 80% of the premium. Departments can choose to cover their graduate fellows, may choose to cover payroll through department pay. That shouldn't be payroll. That should be insurance, that they can cover their insurance through department paid insurance. And international DFs are automatically enrolled by Student Health Center. So if you have a GF who is international, Carrie takes care of that enrollment, and we'll talk about that later. What about the students whose award isn't on payroll but is specified by monthly payment? Heather, we just covered that. That's a graduate fellow, and your department would be responsible for enrolling those students directly with United Healthcare and EMI if your department chooses to pay for their insurance. How is GSHIP funded? The main portion of GSHIP is covered through an employer payroll deduction, and that covers 80% of overall costs. The deduction will always be charged to a benefit account of the chart field that the student is paid from. So please make sure that you're using appropriate fund types when setting up payroll. The graduate school collects the employer deduction, and it's charged to a benefit account each fall and spring from either the TA benefit pool, an RA benefit allotment, or funds available in a graduate research or graduate teaching activity. Again, this payroll deduction, it does not affect the student's check. It is recorded in the payroll account numbers on your financials. So it'll be in the 50,000 series. RAs must be paid from a grant, a 5,000 fund that has a benefit allotment for each student researcher. And TA benefits are automatically reimbursed by the Vice President's office as long as they're paid from a 1001 fund. If you have TAs, your GRs, or any other eligible type being paid from other than a 1001 fund, there is no automatic reimbursement, and that cost hits your activity's bottom line. So it is a true expense. That's why we mentioned that you need to ensure that you have the funds available for your GRs before you offer GSHIP. I see there's a question. Okay, that was just they're thinking what the DF is. Why does it? I am not having a good day today. Sorry, everybody. Now I can't find my proof. I'm gonna not use my mouse. Student fees, 20% of the costs are billed to the students. That is billed through income accounting. And it's usually billed the week after the tuition benefit portal closes for the semester. And the spring fee is going to be larger because it includes summer coverage as well. Do we have any questions on this slide? Okay.
If a student graduates in spring, do they still have to pay the full cost of summer
Yes.
tuition?
Yeah.
Yeah. Okay. No way to like early terminate that or anything.
Nope. If they're on GSHIP, they're billed for spring, summer. That way they have coverage in through the summer months. They may or may not choose to use it because they might have a job where they have employer based, but we do not terminate GSHIP coverage sooner.
So then the only way for them to be insured for just spring would be to do like a department ad or something.
If you wanted to pay that through department, yes.
Okay. All right. Thanks.
You're welcome.
I have a question.
Mark, wait, and then Mark, and then you can add them as a department. Some departments add students and then they have the students reimburse them with a 20% via a check. So that's always an option. Or you can have the student choose to enroll themselves for the spring, and then you can do a student reimbursement payment for 80% of that cost. But otherwise, GSHIP goes through 1/1 through 8/15. Barb.
Yeah, so if a training grant can pay 100%, but they're an RA, so we put them on the TP, which gives them the 80%, and the spreadsheet that United Health gives, if I recall, if the calculations are only for 100%, and so I'm wondering how we pay for only 20%.
Are you talking about a GF?
No.
An RA?
Yeah, let's say it's an RA, right?
An RA, and they're eligible for subsidized health insurance?
Yes, they're 100% RA, so they get 80%.
The grant gets charged 80% and the student is responsible for 20%.
Right, but let's say the department wants to pay the other 20.
Pay it through scholarship admin.
Okay, thank you.
You're welcome. The student will be assessed a fee on their tuition statement through income accounting. So you can go into scholarship admin and set up an item type insurance only, and then you can pay the amount of the student fee that way. And then that way the grant will have 100% of the charges. 80% will appear in the benefits section of the grant. The 20% should appear in the non-payroll section called student insurance. You should never, ever, ever, ever pay for a student insurance through scholarship admin and charge a benefit line item, because the benefit line items are specifically tied to payroll and payroll related charges. Tamara.
Yes, what happens if a student has both an RA and a TA, is primarily TA? How does the charges work for that?
Well, if you set the student up correctly into the tuition benefit portal, and the student is primarily a TA, say 80%, and they have a chart field that sends or a distribution code that sends their pay, 80% of their pay, 80% of the insurance charge will follow that TA chart field.
And if they're primarily RA, then it's the same situation.
It's the same situation. So you would need to make sure that the prorations in tuition benefit match the distribution code prorations on their payroll.
Okay.
In order to have those expenses match the payroll distributions.
Okay, and then my other quick question was, when the student has a TA, say under a 2,000 fund, what amount is charged to that activity?
80% of the premiums.
Okay.
So in the spring, I think it was maybe 1,400 was charged to the 5,000 section of that activity.
Okay. Thank you.
Okay, you're welcome. Any other questions? Okay, we'll talk about how GSHIP is enrolled, and then this slide actually covers the question that Tamara had, where you want to look at how do I make sure that the expenses related to GSHIP properly are accounted for using the distribution percentages for the student's payroll. So the departments indicate if a student has elected GSHIP through the tuition benefit portal. See this tiny little box here? That is what needs to be checked, and that's the one that causes us some problems and not problems if it's not checked or if it's checked incorrectly. But this little box is what tells our department who wants graduate subsidized health insurance. We are hoping, as I had alluded to on Thursday or Tuesday with a spoiler alert, we are hoping that in the fall semester that we will have the upfront job code validation removed. So this will allow you to enter your students in on a more timely fashion, mainly for insurance enrollment. In the spring, we piloted what we call rolling enrollment, where every week we downloaded information out of the tuition benefit portal, and any new students electing insurance, we enrolled them on a weekly basis. Rather than in the past, we usually waited until after the portal closed to do our big enrollment. And as we know, this caused a lot of issues with students who required continuation of medical care, but also that needed to enroll their dependents. So we have been working with UIT tuition benefit team to have that job code validation removed, so that once the portal opens, we can start enrolling GSHIP students for the 8/16 effective date, and that will facilitate the students' enrollment for their dependents. So we're hoping that everything goes smoothly. More importantly, and that's why I have this bolded, is you need to have a way to verify from your student that he or she wants the GSHIP. There should be some form that they've indicated that, yes, I elect to have student health insurance. I recognize that I'm going to be assessed a fee to which I may or may not be responsible before, such as if your department may be covering it or not. So you need to lay out those expectations because the more often than not, and especially in the spring versus the fall, we'll have students say, well, I don't want the insurance. I didn't know there was a fee. And we can go back to them in the department saying, well, you signed this form. We went through this. We told you it would be X number of dollars and you agreed to this. It's just great to get it upfront and in writing or an electronic format. So if there's ever any question, and conversely, we've had times where a department has erroneously added health insurance for a student, and then we've been able to go back to the original source document and say, yes, you're right. We shouldn't have added this insurance. We're going to remove the fee. So that's why that section is bolded, because it's really important that we have that documentation to fall back on if there's ever any questions about insurance coverage. Once the tuition portal closes, changes to the insurance census are highly discouraged. It becomes a very manual process after we close the portal, and to undo everything that we've done takes time, and then I have to go back and re-reconcile everything. So the more we get into the habit of ensuring that we have source documentation indicating that the student wanted the insurance and that they knew what was expected from them for this insurance, and reducing the input errors, it will make reconciling the student health insurance subsidized program that much easier. When it comes to department paid enrollment, some departments may choose to pay premiums for students who don't qualify for regular subsidized insurance. These would be your students that are graduate fellows, and also students that may have a 75 or 50% tuition benefit. Or your department may just choose to enroll students that don't have a benefit, but maybe have another funding source available, like an independent fellowship. They need to be taking a minimum of 3 credit hours. It's my mouse. To be eligible for the student health plan. In 2021 and beyond, most departments only need to enroll GFs. The tuition benefit, the subsidized insurance program opened, became eligible for your graduate research and your graduate teaching assistants, so that are 100% benefited. So I believe department enrollments may have gone down, since we did pick up about 200 to 300 students per semester on the subsidized plan. And you should really only be enrolling your fellows, because if you have if you're enrolling an RA, that means that you have funding available, and the student can be put on the subsidized health insurance. And then if you don't want the student to pay their 20%, you can always then enter a scholarship to cover their costs. Remember to report insurance payments and reimbursements made on behalf of a student through scholarship admin. All coverage automatically terminates each year as of August 15th. So students must be re-enrolled each fall for coverage to continue. In order to enroll a student, departments, you need to use your use the provided department enrollment spreadsheet for United Healthcare, and or enroll your students with EMI via the online portal. If you need access to either one of those or have not used them previously, please reach out to us at tuitionbenefit@gradschool.utah.edu. But as we talked about on Tuesday, our inbox is currently automatically deleting all new email. So please be patient with us as we're working through that problem with the UIT department. And importantly, make sure you use your correct location code, and the location code is the same for both United Healthcare and EMI. Teresa put in the chat, and do you have a template we can use? This form that students agree to want the insurance. I will look. I don't know if Jolynn had anything, a template set up or not. And if we don't find something, I can work with Matthew on setting up a template that can be used throughout the departments. When you are filling out your United Healthcare spreadsheet, you submit it to SID Premium at United Healthcare Student Resources, UHCSR.com. Please, 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 in the subject line at the beginning, use the 3 letters PHI. We are sending sensitive information to United Healthcare. In some cases, the student's Social Security number is filled out, but in all cases, their address, some other identifiable information protected through HIPAA are on these enrollment spreadsheets. And it's important that we send them securely. And in the university, using the letters PHI, which stands for Protected Health Information, that lets our email servers know this needs to be sent securely, and the recipient receives it via Cisco SIST. Periodically throughout the semesters, you'll receive an invoice from United Healthcare. And once you know that your census is correct, you can pay that invoice at any time. You'll also use your spreadsheet to update contact information or remove coverage. For vision and dental enrollment, it's a little bit easier. We have access to EMI's enrollment portal. So enrollment will be made online by the census deadline for each semester. EMI will supply each department with either a semester bill or an annual bill. And failure to meet payment deadlines may result in retroactive termination of your student's coverage. Laura put in the chat to everybody. She says she believes that there is a template on the department resources section of the graduate school tuition benefit website. There probably is, but I'm going to caution you that it might not have been updated during 2021. So we will look at that. Thanks, Laura. Okay, let's go over the enrollment methods because there are 2 different ways. I just had explained it, but this is a different view. On the left-hand side, we have United Healthcare. It's using a spreadsheet. Department paid will only enroll their students that are covered by subsidized health insurance. The graduate school enrolls all students that are eligible for subsidized health insurance. And then you email the spreadsheet to, and then I will update this slide before it goes public with PHI in the subject heading. For EMI, we use the enrollment, the EMI enrollment portal. Every fall and spring, EMI activates what's called open enrollment. So that facilitates entering information into their portal, because if you had a student who had insurance last semester, all you need to do is go through open enrollment and change them from terminated to active. And then the student is then eligible for insurance. Again, our department handles anybody who is on subsidized health insurance. So if you see a student that is no longer eligible for subsidized health insurance, you can change their location from one to your location. But for the fall, don't change it to location 1. And then you need to complete your initial enrollment for both the spring and fall and spring semesters by the enrollment line or by the portal census deadline. Okay. When it comes to dependent enrollment, if the student is on GSHIP, the student can self-pay for their dependent coverage. With United Healthcare, subsidized students must add dependents during United Healthcare's open enrollment period for each semester, if they're not adding annual coverage in the fall. They don't need to wait for their own coverage to be processed, but they should follow the following steps. They go to the United Healthcare website specifically for Utah, enrollment info, and then dependent coverage page. And then that form reserves your coverage for your dependent. And once we process their enrollment information, the student's dependent coverage should begin. That's why we're really working on this open enrollment or this rolling enrollment with our subsidized health insurance. This will facilitate this process for students. With EMI, this hasn't changed since we started with EMI. Enrollment for dependents is on a separate form. We will be sending the form out to the departments in August. There's a box at the top of the form that needs to be checked to indicate that the student's responsible for the premiums. And currently, dependent enrollment form is the only method to enroll dependents for subsidized students. And you need to email, new this year is you as the department can email the form with PHI in the subject heading, because in some cases, these forms include payment information directly to tbell@emihealth.com. You no longer need to send your forms to the graduate school and then we forward them on to Taylor. This year, and we started it in the spring, when you collect your dependent enrollment forms for EMI, you can scan those in and send them securely to Taylor and she will process them. When it comes to GSHIP and the department chooses to pay the student's insurance or dependent premiums, for United Healthcare, you add the dependents using the department enrollment spreadsheet. If the student is eligible for GSHIP, you should still use your department enrollment spreadsheet since your department's paying for the premiums, but you don't change the student's location. And is there somebody on here who has done that, who has enrolled dependents for students who are on GSHIP? I hear crickets. Anyone? Yeah, because I usually handled all the GSHIP responsibilities, so kind of venturing and dipping my toe into what the departments do is new for me. So I might be reaching out to department because I don't understand, because you have to put the student on your form, but you've got to indicate that the student is in location 1, but yet the dependents will be billed to your location. So you would enter your location. So
Jennifer, I might be able to speak to that. So
thanks, Sarah.
So our students are on GSHIP because they're graduate fellows. However,
Yes.
last year I did have an international student who had a dependent, and we do pay for our international student dependents. So what they had us do is we put our international student on the United Healthcare form and then put the dependent on there as well. And so even though the graduate school pays for the international student themselves, we then paid for the dependent as secondary. So we put her information, her unit, all of her information, and then his information was secondary.
Okay.
And so we paid for him. The graduate school paid for her as normal. The only thing that did happen is they did have to, rather than pay fall and spring like normal, they did have to cancel it out and pay hers all in one go.
Yeah.
They couldn't do the fall spring because we just pay fall spring all at once.
Okay.
So that was the only thing that we noticed as a difference. But yeah, that's what they told us to do, is put our student, we indicate that the student is paid through the graduate school, but we pay for the dependent. So
yes, and that's an instance where that's the exception rather than the norm, where we would have put the student then on annual coverage through subsidized health insurance to help facilitate the payment of your dependent coverage.
Yeah, so I don't know if that helps at all, but that's
No, it does.
the process that we go through when we have a dependent that's an international student.
No, that does. Thanks, Sarah. For EMI, and then I'll reiterate this in another slide, EMI is traditionally more of a corporate insurance provider, and we were lucky to have them expand into higher education insurance. But with that said, their billing is more of a traditional model. It's not set up like United Healthcare, where the student could be billed in one location and the dependent coverage goes to another location. So with AMI, again, you have to use the form to add dependents for vision and dental coverage. On the form, you're going to check the box that says the department is responsible for the payment. And then you're going to send the form into EMI with PHI. Now, if you're enrolling dependents for students on subsidized coverage, that dependent coverage will appear on our bill. And I will then be asking your department for a chart field, which I haven't done yet for the spring, but it will get done by June 30th. I asked for a chart field, and then I bill the departments, or journal entry the departments, the dependent coverage premiums. So that's how that works with EMI and students who are on GSHIP. Again, as I had stated a little bit ago, I was more involved with just the subsidized end. And I didn't even know there were open enrollment dates. So, but there are, and this year we reached out to our contact at United Healthcare, and here are the open enrollment dates for students who wish to add dependent coverage and pay themselves, or for students that need to add voluntary coverage. Our contact indicated that these dates will be posted in the brochure and or on the website for students and admins to see at any time. The cutoff date is the last date students are able to be enrolled in the plan for that period. So if a student needs to have their dependents enrolled for fall coverage, the open enrollment date ends on September 30th. However, there's with a compelling reason, can still enroll students up until 10/16, or they can enroll their dependents up until 10/16. Anything after that, they are open enrollment has closed, and they will not be able to add their dependents until the next semester, unless they work out something with their department, and departments have a little more flexibility when it comes to enrolling students throughout the semester. This is where Carrie gets to join us. These next couple slides will talk about international students. They're required to have health insurance. I believe it's federally required that all international students have health insurance. Each semester, Carrie's team automatically enrolls international students in the voluntary student health plan. She enrolls, like we do for GSHIP, twice an academic year, one for the fall and the other for spring, summer. The students are billed via income accounting for the full premium at the start of each semester. Students are not automatically enrolled in the vision and dental plan by Carrie's department because it's not federally mandated. However, if there's an international student who's eligible for GSHIP, our team does enroll that student. Carrie, is there anything else that you'd like to add?
I think that it's important to know I only enroll F1 and J1 visa holders.
Okay, I will update the slide. Okay. We also recognize that there is a timing difference when it comes to when Carrie's fee for international students are posted and when the student's 20% fee is posted. And then we've got to go back and then reverse the student health insurance fee. So we recognize that there is some timing when it relates to all that. And in some cases, there are some manual processes involved. So I think that there's somebody who's looking into that, and hopefully we'll have some resolutions that could speed up the removal of the international fee if the student is going to be eligible for subsidized health insurance.
Yeah, I have asked IT to see if they can, once you place the charges or they are notified that these students are available for benefits, that they automatically remove my charge. So hopefully that will take place and that will straighten a lot of the confusion out.
And that will help both you and I. Here's everybody's favorite F word. It's a flow chart. This is a very old flow chart that I found. And as you can see, I've had to make some updates because I can't find the original about international graduate student insurance enrollment options. You know, there are some questions about when we have international students, do we pay this through scholarship admin? How does the student pay? Or, you know, if they're on GSHIP, what happens, etc. So if we start at the left where it says start, and you can see my cute little blue bubble, it says it now includes GRs and GTs. You know, if the student's eligible for 100% tuition benefit, then, and the students indicated that, yes, they want that, you'll enter that information in the tuition benefit portal. And then if your department's covering the 20% fee, you'll need to enter that amount through scholarship admin. If not, the international student will need to pay that portion on their tuition bill. If the student is not eligible for GSHIP, the next question is the department covering the insurance premiums for the international student? If the answer is yes, then you pay the health insurance through scholarship admin. The next decision is your department offering health insurance or vision and dental? If that's yes, you enroll the student via the EMI's web portal, and then you'll receive an invoice for that you'll pay directly to EMI, but then you need to report the vision and dental payment on behalf of the student and scholarship admin as a miscellaneous award. Back up top, if your department isn't covering the insurance premiums, you can ask, does the student want to have health insurance or the vision and dental insurance? If they answer yes, the student can enroll themselves through the EMI website for vision and dental. And then all the way over to the right, if you're not covering it and the student doesn't want vision and dental, then the student is responsible for their health insurance as it appears on their tuition bill. Questions? Oh, thanks, Matthew. Are there any questions on this flow chart? It was on our website under coordinator resources. I don't know what happened to it, but I'm glad because it's a little outdated. So are there any questions on international graduate students eligible for GSHIP and insurance options? Does the international student need to be included on the spreadsheet? No, because Carrie's team automatically enrolls those students at the beginning of the semester. So if you have a GF who's an international student, Carrie will already be enrolling that student. And then you would then, if your department is covering that insurance, then you would follow the second decision where you would pay that through scholarship admin. Okay, next. Okay, there was a question in the chat box about premiums, and here's our slide. As you can see, for United Healthcare, it's not very large because we're still waiting on final rates. But from the last communication update I had from Matthew, that the rates are expected to increase approximately 7%. Is that right, Matthew? So I think, and I put in last year's rates. So if you wanted to estimate a ballpark figure, you can take that rate and adjust it 7. And that should give you a good guesstimate for the 21-22 premiums. Right, Matthew, is that correct? Okay, his head nodded. Over on the EMI side, we were able to get our EMI rates back in April, and we were excited to see that they decreased 10%. Since our relationship with EMI, our rates have been decreasing over the last several years of our contract. Which is great because they actually look at our usage and what we carry over and what's in our pool. And this year we were able to receive a 10% decrease over our 2021 rates. So for your dental plans, it'll cost a student it'll cost a department or GSHIP $53.10 for the fall, and in spring summer it's $88.50. Again, with our vision plan, we were able to receive a 10% discount over our 2021 rates. So our fall rates are now $23.40 and our spring summer rates are $39. Okay. When it comes to reconciling your department or GSHIP censuses with United Healthcare, you can request an invoice at any time during the semester, and then you review your EMI or your United Healthcare bill, and then you make any adjustments necessary through the United Healthcare spreadsheet, and then you can look at those changes, request another invoice. When we reconcile through here at the grad school for GSHIP, I usually request about, I bet, 6 to 10 invoices before I'm ready to pay the bill for the fall semester. With EMI, we will be receiving a census enrollment from EMI. And as in previous years, then I will send that out to the departments. The departments will need to review their data using the location code that's found on the spreadsheet. If you have changes that need to be made to your census, you'll do that through the portal. All department changes to the semester for fall semester need to be completed by 10/1. Spring semester changes need to be completed by March 1st. Our team works on location number 1, but in the spring, if you have a student that you paid for in the fall and you know is going to be on subsidized health insurance, during the open enrollment period with EMI, you should have access to change that location to 1. And also concurrently, if you had a student that was on subsidized health insurance for the fall, but you know isn't going to be on subsidized health insurance in the spring, you can change that location from 1 to your own location during the open enrollment period. And if you all ever have any questions about that, feel free to email me or give me a call and I can walk through that process with you. When it comes to the billing, again, each insurance has its own method. It's very simple with United Healthcare. We can receive invoices at any time during the semester. And once you know your census is good, you can go ahead and pay your invoice through United Healthcare. You pay that, through the EPR system. When it comes to EMI, usually at the end of October, the 1st of November, EMI will produce 2 bills in the fall. They'll produce a bill for fall semester, which will be from 8/16 to 12/31. And they'll also produce an annual invoice, and that would be from 8/16 through 8/15 of the following year. If you are 99.999% sure that you will not have any changes to your EMI invoice, you can go ahead and pay that annual invoice. But if there's a slight chance that you might have a student rolling off of EMI or rolling on to EMI in the spring, pay your fall invoice. And then in the spring, EMI will produce invoices at the end of March and then pay your spring invoice. When we first started with EMI, most people were paying their annual invoice, but then that came into a lot of reconciliation errors because we had students rolling off in the spring, but we paid an annual, etc. So unless you are almost 100% positive your enrollment with EMI is solid, just pay your semesters. It'll just save you some time and headaches in the long run. This slide is an overview that shows the 2 different methods when it comes to dependent coverage with students on GSHIP. Again, graduate school does not pay for dependent coverage, and with United Healthcare, we don't, because you're able to, and as Sarah pointed out, you're able to enroll your subsidized students' dependents on your department spreadsheet, and their premiums then will follow the department and you can pay for them that way. Whereas with EMI, the dependent premiums follow the student's location. So if the student's location is 1, the dependent's premiums will follow and be put on location 1, subsidized health insurance's invoice. So that's when I will request, or our team will request an invoice. Oh my goodness. I'm just not using that anymore. That's when our department will request a chart field to so I can journal the dependent coverage when paying the EMI invoice. Is there any questions on that? Okay. This is just an overview of what the EMI portal looks like. You've got your login, and then you should have access to both EMI Health. That's where you'll do your enrollment. And then this is the EMI bill, and that's where you'll look for your invoices. Laura, that's good to know. Laura put in the chat that they never hear from EMI like they do United Healthcare. Yes, EMI is supposed to be sending information to the students to the email that we give them. It's their U email at utah.edu. So it's their unit at utah.edu. 9 times out of 10, it gets put in. If those students have a proxy on file, that email will be routed to their proxy, and 9 times out of 10, it's in their students' junk or spam folders. So if you have a student that says that they haven't heard from EMI, ask them if they've checked their Gmail or Yahoo mails, junk or spam folder, and they may find something there. We will also bring that to the attention again to EMI, because we hear that more often than not. So we'll have to work with them on that. At least it's not like the first year where they mailed everything and some students don't know their address. So we had so much of returned mail that we then had to reach out to the departments and have the departments come and pick up their paper copies and then distribute to the students. So obviously we're having some problems still reaching our students with EMI, and that's something that we need to work out with our vendor. In the billing portal section, in the fall, you'll see 2 invoices, one that says fall and one that says annual. You can also upload, if you make any changes to your invoice, you can upload that document right into the EMI portal, and their billing team will then take a look at that and use your spreadsheet to help reconcile their payment. When you're paying the invoices for United Healthcare and EMI, you need to make sure that you select student and education payments. I still see departments paying United Healthcare and EMI invoices with miscellaneous vendors less than $5,000. You are making a payment on behalf of a student, and it needs to be properly recorded in our system for audit purposes. So please remind your accountants, assistants, whoever processed the invoices, that these particular invoices should be of payment type student and educational payment. The vendor numbers for United Healthcare and EMI are listed. In prior years, there were 2 EMI Healthcare vendor numbers. I had a discussion with accounts payable, who then had discussions with EMI, and in the spring it was decided that the number that's reflected here, the 281879, is the correct vendor number to be used for EMI Health. And on any EMI Health payments go forward, this is the number you should use. As a matter of fact, I think the other vendor number has been taken offline. So if you do a vendor search for EMI Health, the 281879 number is the only number that you should see. And also, when you are paying the insurance bill, in the chart field, the account number should be 65810, which is called student insurance. General accounting set this specific account number up a couple years ago, and it's important that we use the correct account number to capture the correct expenses at the university level. And finally, I used to call this my shout out to Matthew, but we have Matthew now, scholarship administration. payments made on behalf of a student should be recorded in scholarship admin. So you would go in and to award the student, it's a miscellaneous item type. You can report the health and vision, dental, and as one total. If you're paying the semester invoices, you report the fall amount in the fall and the spring amount in the spring. If you're paying an annual invoice, report the amount that was paid in the semester that the bill was paid. So if you pay the annual invoice in the fall, report it in the fall. If you pay your annual invoice in the spring, you report that total in the spring. And then is there any questions? Are there any questions? I apologize for all my technical difficulties. I see people are awake, blink, something. Oh, good. Thank you for showing. Oh, good. People are alive. Thank you. Wake up. Time to wake up. I'm done for the week. You guys never have to fall asleep again. Do we have any questions? Was it that thorough? You're thoroughly confused? As Miss Dima used to say in 8th grade communications, clear as mud? Okay. I bored myself. I don't know about you. All right. I guess we're done, Matthew.
I guess so. 25 minutes early. So you have more time for yourselves now. As a reminder, next week on Tuesday, we will be discussing scholarship administration and how it relates to tuition benefits. And then on Thursday is just going to be a big open forum for any questions that you might have. And again, that's open to tuition benefit coordinators, your accountants, your grants and contracts folks, anyone who might have any sort of question about tuition benefit, scholarship admin, extended tuition benefit, GSHIP, all of that. And I'll send out a email reminder to everyone about that. This was recorded, so we will be putting this on the website along with the PowerPoint presentation for you to refer back to as needed. So with that, thank you everyone for joining us today, and we'll see you next week.
You're going to edit that, right, Matthew, where I had all my problems? Yeah.
No.